Good afternoon. This is Renee Norden. I am the Executive Director of the Mental Health Association, and I am so pleased that you've joined us to talk about building resilience in youth. I have only been here at the Mental Health Association since November, but my background, I've spent 21 years in high schools working with young people. I also worked for the Rappahannock Rapidan Community Services Board as a prevention specialist and an emergency mental health clinician. The thing that excites me so much about building resilience is it's proactive. It allows people to feel like they have control in an area or in a situation, and know that even if the situation just doesn't go as they planned, it still can be a win. And so today we're going to talk about a number of things. We're going to define resiliency, talk about how to build resiliency, maybe what are some key things to look at as a person who is helping raise a young person. And some of these skills will even pertain to your own life. So first of all, what is resiliency? You can read the definition right here, but it is that ability to bounce back, that ability to, even when everything is maybe not going in your direction, you can still remain positive and still move forward. It is a great gift to give ourselves and the children we're working with. So what are the benefits? Why is resiliency so important? We know that with strong resilience, we are able to increase our emotional and our mental strength. We can bounce back quickly from disruption. It's funny, a number of years ago, the New York Times came out with an article. They were talking about successful college applications. In my previous job, I helped individuals with their college applications. So the New York Times comes out and says, grit. Grit is important in college applications. And what is grit? Grit is basically a slang term for resiliency. Now, the New York Times saying this caused a number of my parents to actually call me and ask if I could help increase their child's grit, which isn't really what my job was, right? In order to get grit, you have to have adversity. And by having adversity and coming successfully through adversity, it creates resilience. All right, so that bouncing back. It also allows people to take situations that aren't to their benefit, negative situations, find maybe a silver lining. An example of that might be the pandemic. None of us would say we would ever want to be in a pandemic before, again, but there have been silver linings. There have been maybe you learned that you needed to spend more time on yourself or things like that. So creating positivity out of negativity. And then also one of the great benefits of resiliency is gaining that independence, something that we want all of our children to do. So what prevents individuals from forming resiliency or having resiliency? I love this picture. If you think back to your youth, that feeling of invincibility, that you can handle anything, that is the beginning of resiliency. And what we want to make sure of that as our young people are challenged through our support and the support of the loved ones around them, they come through that adversity and they learn skills of resiliency. And so they'll be thriving despite those challenges. So those challenges, what are those challenges? For each individual, it is different. It depends on the child. It depends on the adult. Some things bother us more than others. But when we're talking about children and school-age children, the pandemic, of course, had an impact on their schooling, and that could cause feelings of pressure. Those going back to school, our children in this area are going back August 11th. Those could also create pressure. Bullying, changes in schedule, maybe parents divorcing, changes in visitation schedule, academic challenges. Sometimes these pressures even manifest in physical feelings. So I always talk about that school nurses always know, probably who's having difficulty before the school counselors or maybe even teachers know, because those are the kids that show up with the stomach ache. Or, maybe every time Algebra 1 is happening, they have a stomach ache and are at the nurse's office. So just any of that feeling of academic pressure, maybe not doing as well. For our older children, thinking about what's next, what's after high school. Are they thinking about college? Are they thinking of entering the workforce or maybe acquiring some skills in order to, maybe in an apprenticeship or something? Still, those are pressures. And then, of course, athletics can add pressure. At home, sometimes children feel the need, sort of competition between siblings for parental attention. Hostile, silent, or unsafe homes can cause pressure. Some people question why I put silent. Sometimes silent homes can be just as devastating as hostile homes. So make sure there's a healthy level of conversation. Moving, of course, and then, of course, loss of a loved one or an illness of a loved one, whether that be a human or a pet friend. All can be pressures. And there are also other things. So if you, a child who doesn't develop resilience has things always done for them. I remember my grandmother did a lot for her children. And finally, my grandfather said, this is a story he was telling me, that he had to have his wife step back. And remember, all these are age appropriate. So of course, you aren't going to ask a toddler to run errands for you, right? But having a 16-year-old with a new license run errands for you would be developmentally appropriate, right? Having no responsibilities. Some parents believe, or some people raising young people believe that, don't give them chores, have them enjoy their childhood. That actually is counterintuitive for forming resilience. These children need to have responsibilities, and these responsibilities need to be real. They need to actually benefit the family or benefit the community. Redoing things that they have done. So when you ask, maybe a chore is having, your 4 or 5-year-old set the table. If the table isn't set perfectly, instead of, well, first of all, let's talk about what perfect means. But instead of redoing it, working with the child to then set it so it's appropriate would then give them a feeling of, okay, now I know, and I can do it better next time, as opposed to the parent or the other person just redoing it. It takes away from that resiliency building. I remember once I had written a paper years and years ago. I think I was in middle school, and this is before computers, and the paper had to be typed, but I didn't have a typewriter. So my father asked his secretary to type it. And when I got the paper back, it really wasn't the paper I wrote. And so that was crushing for me. Of course, the secretary was just trying to help, but it did, sort of point to me as a middle schooler that my work wasn't good enough. So helping them redo things that they have done, not doing it for them. Just like I know some parents try to help them with their homework. It's their homework. You completing their homework for them does not promote growth. It just promotes dependence. Stepping in to make things easier for them. Having to live with consequences is a great way of forming resilience. And if you step in and prevent those consequences from happening when they're little, so maybe when they were little, they bit someone. Stepping in and making those consequences go away will not be beneficial to them, because then as they get older, they expect those consequences to go away. And unfortunately, the stakes get much higher when they get older. We need to be careful of sheltering them appropriately. So young people, I would even say all of elementary school, don't need to hear the news, right? Don't need to hear that a bus, there's been a bus accident in India and multiple people were killed. They need to only hear news of things that impact them directly. Otherwise, the world can be an overwhelming place. So sheltering them appropriately is a good thing, but also letting them know, if somebody is ill or things like that, because children are amazingly intuitive and they know when you're hiding things from them. The other thing that challenges resilience is long periods of stress, and then also trauma and personal loss. So we need to look at those, especially to help mitigate those in some way, process them so that it actually ends up being something that builds resilience, not takes away from it. A lot of people talk about emotions. Now, if you all have ever been with a teenager, you know that emotions can, change in a nanosecond. I think it's important, though, instead of thinking about emotions in positive and negative ways, to really think about it in positive and disruptive ways. So, of course, there are lots of positive emotions. The things we need to be more concerned about are those disruptive ones, those that won't benefit the child in the long run. So if there are any procrastinators out there, I know that feeling anxiety might help motivate you, but other anxiety that is not about certain things, but just a general anxiety, is definitely something that needs to be looked at, as does fear, anger, vulnerability, and helplessness. Those are, things that everyone will experience in the short term, but we want to make sure those aren't long term. And when people are feeling that way, talking about those feelings, what those feelings are tied to, and how to get through them, how to make steps to make them feel better, is a great gift for them. But now that we've talked about what disrupts forming of resiliency, let's talk now about how to help youth develop resiliency, and even help yourself develop resiliency. So we know that emotional states impact us. What we might not always remember is adults' emotional states impact children's emotional states. So we need to model emotion regulation, planning, things like that. By modeling these things, it will help your child or teen. But we also need to respond appropriately to our children's emotional states. We talked about positive emotions already. One of the things we really can help children process is talking about, it's not the situation, it's how I respond to it. I remember years and years ago, before I had children, I took a course on emotion at George Mason University as a counseling student. And I remember coming back and telling my husband that we choose our emotion. And he was up in arms. We don't choose our emotion. Emotions just happen. Well, no, we actually choose them. Now, I'm not talking about, say your goldfish dies. Okay. Now, you might have had a great relationship with that goldfish, right? But is it such a relationship that you are choosing to be on the floor sobbing? Or is it just something you shed tears for? So that emotional regulation, choosing where in that emotion you are going to fall, is powerful. Just because somebody thinks you should react in a certain way doesn't mean that you need to react extremely. Reacting more with moderation will give a person a sense of control, a sense of peace and calm. Okay. But these reactions to emotions are ours. We choose to react that way. And that sometimes it takes a sort of nanosecond to process, okay, do I want to lose my cool right now? Is that going to help me? Is losing my cool ever going to help me? Great way of learning that emotional regulation. Okay. And then after the situation is resolved, after you come out of it, talking to your student or your child about, what did I learn from this? Even talking to yourself about that. When I drive home from work, I like to think about, okay, how was my emotional regulation today? Is there anything I would have changed? Because the more we become aware of it, the better it is for us. Right? Problem solving, great way of building resilience. The trick is the adult has to model it. So instead of hiding from the situation, instead of remaining quiet about the situation, just sharing that, hey, I have this coming up. This is what I'm thinking about. These are my choices. You know, I'm going to prepare for the best. I'm going to prepare for the worst. It's going to, you know, something's going to happen in between, you know, showing them how you brainstorm ideas. Now, this isn't something that has to be done every day, but just so that maybe children can see small issues, like trying to figure out what I'm going to wear. You know, a very young child, taking them through what your thought process is when you're picking what you're wearing is a great thing. Maybe as children get older, maybe in middle school when they get to choose some of their own electives, you know, talking about choices you're making in your life might help. But what you want to do is allow the child to talk about what they're thinking about the situation, have them brainstorm different situations, different solutions, and then talk over those solutions with them, and then have them pick. Always remembering that the easiest solution or the easiest choice might not be the best, and then supporting them through it, but having them act on it. I found out very early that if I was the one brainstorming and giving them possible solutions, then when that solution didn't work, it had nothing to do with the effort the child had put in it. It was all because it was my fault that I gave them a stupid idea, right? So they need to own, they have to have ownership of what they're going to do. And then after the whole situation is finished, going back and talking about that, you know, now looking back on it, do you think that was the best, you know, solution that you chose, or would you have chose a different one? And the reason why you want to process it is because you want it to become a learning event. You want them to take what they learned in that situation and apply it later. Next, the other thing, we've talked about emotions, but one of the great things to do is celebrate those paradoxical traits. And some people are like, paradoxical, what is that? It's just opposites. You know, having emotional regulation, having the resiliency and the flexibility to be able to be playful and serious, right? Aren't always at the same time, but playful and serious, self-critical and self-appreciating, right? Being able to do both of those extremes is a great gift to yourself and for your children. And then trusting and cautious, right? So that flexibility, being able to go back and forth between these different types of opposite emotions really is showing flexibility and resilience. So Dr. Kenneth Ginsburg, who works at the Children's Hospital in Philadelphia, he and the American Academy of Pediatrics team together to create the 7 C's of resiliency. And this is kind of listy, I'll call it, but it does give you those 7 areas. And this PowerPoint is available to you at any time if you want to actually examine these further. So the first 2 are competence and confidence. Competence is that idea that I can do this. And the way we help our children have this competence is to give them developmentally appropriate jobs that help the family, help that unit. So it is having kids, you know, we've talked about this, set the table or feed the dog or take the trash out. Could be wiping the table down after meals. Something that a child can do, and as they grow, those skills, those jobs become more significant. All right. We also want to make sure that we only compare the child to themselves. Okay. So, hey, last time I know you had some challenges setting the table, you know, this time it was so much better. Okay. You know, last time when you cooked dinner, I could tell you had rushed it, but this dinner is fabulous. Right. We don't want to compare them to others, right? You don't want to say, oh, when your sister did this, no. A person is an individual. We need to look at them as an individual, as a unique person. All right. And then the nice thing that happens with this competency is the more you do that, the more likely it is for the child or youth then to hold themselves accountable and want to do better the next time. For confidence, we don't want to give false praise, right? People who give too much praise the child you're giving it to is not going to believe you anyway. All right. So when they do well, when you know they've been struggling and they come through, that's great. Allowing them to sort of set their own schedules. Now, when I say that, I don't mean you have a 4-year-old decide when or not when they're going to bed. No, but how full their schedule is. You know, if a child is scheduled, you know, every hour of the day, I will tell you they aren't really developing. They're just following a schedule. Okay. And then we want to also make sure they understand that with this confidence comes that need to be fair, need to be a person of their word, and be kind to others. All right. Developing that confidence. The competence and confidence go actually hand in hand. Next, connection and character. All right. Connection. One of the strongest protective factors a child can have is having a caring adult that is not one of their parents or one of their caregivers, you know, guardians, but someone else outside of that, that they can tell anything to. And that you know that person, if it is a significant threat to the child or others around the child, that that person will come to you to share that. Your job as their guardian, as their parent, is not to be their friend. This caring adult can be their friend. And I know it feels really hard to do that. You want to be everything to those children, right? But it is one of the best protective factors you can give them. It's a caring adult that they can tell anything to. Okay. That builds that sense of physical and emotional security. And also think about the connect, you know, in your own homes. Do they have physical safety? Do they have emotional? Do they have their space? Is their space safe? You want them also to feel and connect with their emotions. All right. It's important to put that phone down. You know, these phones are not great at building resiliency, are not great at building connection with those around you in person. Right. So when you're building those connections, you want to make sure your child has 100% of your attention. Or maybe that you are, say, cooking dinner together. So you are making things together, but you're still chatting and talking. When there is conflict, we want to be calm and talk openly. We don't want to call names. We say things like I statements. I became upset when you missed curfew because, right? Not you are less of a person or you are horrible because you missed curfew, right? We're addressing the situation. We aren't name calling. And then of course, fostering healthy relationships. Healthy relationships are so important. And so with my own children, I would have conversations about, you know, if I saw something that concerned me, I'd bring it up and say, you know, I noticed when you talk to so-and-so, you don't always talk about yourself in a great way. What's that about? Also, the important thing to remember is you're a model for your children. So you want to model those healthy relationships, and staying in an unhealthy relationship, whether, you know, one of your friends you've had for years, if it's unhealthy, it isn't beneficial for you, and it's not beneficial for your children or those you're raising to see that. It allows them, or it gives them permission to think that it's okay that people talk to them in, you know, deprecating ways. Character is an amazing gift that just requires you to model the behaviors you expect and the importance of community. We talked already about hateful statements. We want to avoid stereotypes, and you always need to speak positively about yourself, because that gives your children the idea that that's what they need to do. So if you put yourself down a lot, your children will put themselves down a lot. And then they'll also start believing what you say about yourself. So speak positively about yourself and it will go a long way. Contribution and coping, right? It's good for children to know that there are people in this world that are not as fortunate as they are, and that there is something they can do about that. And it doesn't have to be a monetary thing. It can be a time thing. It can be a thought thing, even writing a note or drawing a picture. All right, we want to foster that genuine empathy, that genuine kindness that children have automatically. And then we want to give them opportunities to volunteer and make other people's lives better, whether that's relatives and friends, or whether that's people in the community. And here in our community, the Path Foundation on their website has a Let's Volunteer page, and that will give you hundreds of ideas on where your youth can make an impact. And sometimes that requires you to make an impact with them, but that's a great thing, working together to help people feel better or be better. Coping, we want to make sure that we are showing and modeling great coping skills. So when things aren't going as we'd hoped, that we are staying calm, we are continuing to move forward. Some days we'll have a down day, and that's okay. But afterward, it's okay also, and it's great to say, hey, yesterday was a down day for me, but today I'm getting back on it. Again, modeling that behavior helps your children develop their own coping strategies. And then also pointing them out to themselves. So, hey, I noticed when this happens, this is what you seem to be doing. Is that working for you? Are there maybe some other ways that you would like to, change the way you respond? And the last is control. Some people who suffer from anxiety want to have more and more control, but we know that that sense of control is not real. So we want to make sure that though things we can't control everything that happens in this life, but for the most part, nothing really happens out of the blue. So we need to pay attention to sort of what's out there and what's going on. If there were a bunch of people screaming and yelling, okay, is that something that we should ignore? Should we go running into them and see what's happening? No, we need to, even though we have no control over that situation, we have control of how we respond. So if people are yelling and screaming and something's going on, I'm going to choose not to go and join them until I know what's really happening. All right. They also need to know where the boundaries are, right? And then what happens after, if they go outside the boundaries. Children are wired to push against those boundaries. That's how somebody becomes more independent, right? So we need them to know and understand what happens when you step outside those boundaries, and then we need to follow through. I was working with a woman and her young child a number of years ago. And so we had talked about these boundaries and what would happen. So we set up this thing. She actually communicated that with her son. Her son was, I think, late elementary school. And they got home and he immediately stepped right outside those boundaries. And she told him he was stepping outside those boundaries. And then she didn't follow through. And so when I saw them the next week, she said, it's gotten even worse. Well, guess what? If you tell a child that these are the boundaries and they step outside the boundaries and they know what the consequence is and the consequence doesn't happen, guess what? That boundary really isn't there. So we need to follow through with what we say. And that the discipline has to be appropriate level, right? So if a child takes a cookie when they knew they weren't supposed to take a cookie, grounding them for 2 weeks is probably too much. So having that discipline be appropriate is what we really need to make sure is happening. So we talked about the 7 C's of competency, and now I'm going to give you some tips on how to build resiliency. We talked about connections. We want to create those opportunities. We don't want to choose our children's friends. We need them to choose, but we can create opportunities for them to be around positive people. Some people do that, say, through youth groups in churches or maybe sports teams. We need to be careful with sports teams just to make sure that coaches are positive role models when things get stressful. And so you can do that by going and watching, seeing how they respond in games and things like that. We talked about volunteering already. It also is really cool if we can find things that our children love to do. So if your child loves the water, maybe a volunteering opportunity where they get to help clean up streams. or if they love to be creative and create cards, then, sending cards to, say, people in the nursing home would be a fabulous idea. Right? To build resilience, we also need a strong foundation. And that strong foundation is routine. So a child needs to know where they are, that they'll get up in the morning, that people will be there, that breakfast will be there, that lunch will be there. And if anything is going to disrupt that routine, we need to make sure the children know that. Now, of course, there are emergencies that happen, and a little disruption is fine, because that actually shows that a child can bounce back in little ways, right? So we want to make sure that they aren't strict routines, but that those routines are there, that there's their bedtime, that there's, a bath time or things like that. We want to make sure that there is routine, because the kids then learn they can count on you. If we're feeling stressed, you can take a break. And that can be as little as like a 2-minute turn the music loud dance party, to a walk around the neighborhood, to, hey, let's unplug, do everything. And this weekend, we're just going to hang out with the family and go to the park or something. So I actually, one of my friends said, the person who probably needs to take a break the most is the one who thinks they can't. Feel free to take individual breaks, family breaks, and teach your children that breaks are okay. Not breaks for avoidance, but breaks to sort of replenish your soul. We want to teach our youth how to take care of themselves, right? We like, as they are very young, we teach them how to brush their teeth and how to tie their shoes. Those lessons need to continue throughout, their early teens, late teens. Everything from how to change a car tire if they're driving, right? How to make sure they have adequate sleep, how to turn off the device, right? Sometimes we have to help them with those, provide boundaries. It was funny, years ago when I first got my license, I got a pretty beat up old car. And the second day I had it, I walked out and one of the tires was flat. So my dad came out with me. He showed me how to change the tire. We changed the tire. Took that in, got it fixed, put it as the spare. Next day I walked out, a second tire was flat. Went into my dad and said, "Dad, my tire's flat." And he said, "Well, I taught you how to change your tire yesterday, so you should be able to do it today." He actually came out and watched me do it, but I did the whole thing myself. And so in the next week, when the other 2 tires went flat, I was able to change the tire myself. Now, I'll be honest, I have friends my age that have never changed a tire in their life. And when it happens to them, they have to call and get somebody to help them. All right. That does not promote resilience. Resilience is knowing that you can handle anything coming your way. All right. We talked about positive self-talk of ourselves already and our children. When they speak negatively about themselves, it's great to say, I don't agree with that. It will have them pause. I don't want to praise them with false praise, but when they say, I'm stupid, I never do anything right. I don't agree with that. I know in the past couple of days, this is what you've done right. So that can't be a true statement. We want to keep things in perspective. I always question when people say things are awful, right? Well, how awful are they? Have you lost an arm? Oh no, okay, you haven't lost an arm, so it's not that awful. How about a finger? Have you lost a finger? Oh no, it's not that awful either. Giving that perspective helps build resiliency, helps stop what I call awfulizing. Awfulizing is the opposite of it. Awfulizing is things are never going to be better. Everything's always going to be horrible, right? We want to get off that train. We want to put what is going on in perspective. And then looking for opportunities of self-discovery, doing things with your kids or with those that you're raising or your grandkids that allows them to learn things they might be good at, right? things that, might have been hard for them in the past that now are easier. Talking about like learning how to ride a bike, right? When they even first started on training wheels, that might have been hard for them. But now with the training wheels off and they are having trouble getting it, you're saying, hey, you're going to get this. Remember when you tried to learn this and it took some time and you got it. So it'll just take some time. All right. So processing that afterward allows them to realize that, yes, with effort, they're going to get through this. They're going to come out in the end. And then accepting change. Change is hard for some people. So much so that people will avoid change, even if they're in a situation that isn't helping them. So we want to make sure that we as parents invite change in our own selves, but also invite change in our children, especially as they age. They are not mimics of ourselves. They are not copies of ourselves. It is not our journey. It is their journey. And we have to let them change. We have to let them become older and become more independent. That is the best gift we can give them. Or two gifts, I would say, resiliency and independence. So we've talked about it in the big picture. I want to break down these skills in age groups so that you can see maybe if you have a schooler, what you can be doing compared to maybe if you have a high schooler. So let's start with the little ones first. So preschoolers, we want to monitor their emotions. And sometimes those emotions are hard. We want to make sure we aren't labeling their emotions, because sometimes we might label them incorrectly. And then because we're their parents or who's raising them, they believe that we're always right at this point. So then they'll have a mislabel of emotion for a long time. So as they're feeling different emotions, instead of saying, oh, you're feeling sad, or oh, you're feeling anxious, say, well, sadness kind of feels like this. Is this what you're feeling? Or anxiety feels like this, or happiness, because it allows them then to label and categorize their own emotions. We need to look for changes in those emotions. If you have a child who's very outgoing, but all of a sudden is clinging to your legs and doesn't want to go, take note of that. Don't make them go be that outgoing child again, because something in their gut is telling them it's not safe. So that's okay. Getting down on their level and saying, hey, what's up? What's going on? Again, getting down on their level, eye to eye, will help have that conversation. And you don't want to have it in front of everyone. So you can go off to a quiet place. Once that situation is over, going back and using play with dolls or coloring and saying, hey, what was going on? Can you put that on paper? Can you draw it? Show me what you were feeling. Might give you a better insight into what's going on with them. As they get older, we want to make sure they have a safe place to talk, whether you all have set it up that maybe it's, on the couch with blankies, or maybe driving in the car, something where the child knows, first off, that it's safe to tell you their emotions, that you aren't going to judge them for them, and that you're paying attention. All right. So when you're having these conversations, put the phone away, be there for them. When they're there, talk about them. Sometimes we want to say, oh, when I was little, that happened to me. That doesn't always help a child. Saying things like, well, I'm, sure that other people in your class are having the same feelings, or I think other people in your class are having the same feelings. But just listening. Don't get to problem solving too early. Allow them really to emote everything they want to talk about. And again, watch TV news. Don't, their exposure to it, to the radio news, to the internet news. Finding out as an elementary school student, they don't always understand that when they hear there's been a bus accident in India and 50 people died, and then they see it on TV, and then they hear it on the radio, and they don't realize that all that is the same bus. So instead of one bus, if they hear about it, let's say 10 times, it's 10 buses. It maximizes those fears. Just as when they're talking about global warming and the political situation, and everything else going on. We need to minimize that and maximize how they can impact their community. For middle school, again, we need them to speak about their troubles. It's great for them to have that trusted adult other than the parent to speak, but always have a way of, a time to talk. Even if it's not, if you're talking about emotions, it doesn't always have to be about emotions, but middle school is really hard. Big transitions going on, physically, emotionally, mentally. And so great to have that safe spot. Understand they're experimenting with who they are, right? So maybe one day they love country music and want to dress in jeans and flannels. And the next day they're listening to grunge and dressing in dark clothing. It's okay. They're trying things on to see what fits, right? And then just watch their stress levels, see what's impacting them, and being able to unplug, being able to take time and just be, okay? And then school age, you're going to need to create connections, time to connect, because kids get busy. We want to watch their relationships. Even though it says bullying here, high school age, it might be better to use the word drama. Look for drama. If there's drama going on, there's bullying going on. But for high schoolers, they aren't going to say they're being bullied. It's more of a middle school term. Drama happens. Look for relationships. Do they have healthy relationships? And just watch those. Make sure that the kids that they're surrounding themselves with are good for them. Now, a moment of just a story I have for you. So a number of years ago, a mother called me and she was very concerned that her daughter was, depressed. She didn't know what was going on with her. It was horrible. She had just ditched all her friends. And now she was hanging out with this other group that the mother wasn't really sure of. Well, I brought, I was the school counselor. So I, brought the kid in and I'm talking to her. And she said, well, if I tell you something, do you have to tell my mother? And I said, well, if you're threatening yourself or someone else, I do have to tell. But other than that, no. And she said, well, my old friends were doing things that I wasn't comfortable with. And I realized that if I stayed with them, I'd probably just finally give in and do the things I didn't want to do. So that's why I distanced myself from my old friends. And my new friends, even though they don't look as put together and are a little more rough around the edges, don't do those things that I didn't want to do. And so that's why I've switched. Okay, so understand how mature that was for that young woman. But for her mother, just seeing it from the outside, she didn't realize that her daughter's old friends were actually getting into alcohol and drugs, and her daughter didn't want that. So I told her about her mom's feelings, and she went to her mother without throwing her old friends under the bus and told her why she was switching friend groups. And then understand that teens have feelings, but it doesn't mean that the boundaries change. It is not your job to be your teenager's friend. It is your job to be their parent or guardian. So let's do a little summary here, just the benefits of resiliency. And you'll find that with yourself if you practice these as well as for your children. More self-confidence, easier to handle change, going back and forth, can bounce back, can help others around them build resiliency without even trying, just by setting example. That stress that they're feeling will be better managed, and they'll end up being, actually, all the research has shown, being healthy, happier, and live longer. So if you're only going to remember a few things, I'd encourage you to remember these, right? Encourage youth to focus on what they control. Anytime you have a child who is worrying or anxious, and they have something that they're worried or anxious about, I always have them say, can you control this? If you're trying to control whether it's going to rain tomorrow or not, it's kind of pointless to be worried or anxious about it because you can't control that. So letting go of the things you can't control. Daryl Bellamy, who we brought in to speak to all our high schoolers last year virtually, He actually has read the research and said they've shown that out of everything we worry about, 80% of those things don't happen. So giving your children, yourself, those perspectives. Worrying is not going to solve the problem. It's just as wasted energy. Listening non-judgmentally is a very powerful way of interacting with our young people. Promoting independence, even though for some parents they don't want their children to leave them. Understand you have to help them become independent, right? And then they'll come back to you. Years later, it's okay to be friends. You don't have to be their parent forever. You do have to be their parent through the early 20s, right? We want to help our children develop those stress responses where they aren't reactive, but proactive. We want them to be able to look at a situation, step back from it, create a plan and follow that plan, and then evaluate how well the plan went. All right. There's a difference between strain and stress. Strain, just like in muscles, helps build up, challenge you. Continuous stress is the reaction you have to it. And so mitigating that stress response is a great thing. And then also we need to remember that if your child or the young person you're working with seems overwhelmed or struggling, and it is impacting their ability to live, laugh, love, and learn, it is okay to seek professional help. That is what we're here for. If I had a magic wand, I would have every middle schooler go to counseling, just because middle school is hard, but I also want them to see that the counseling relationship is proactive, is productive, so that if any other point further on in their lives they need a tune-up, they won't hesitate to go get help. And finally, here are the extra resources. Of course, there's us, the Mental Health Association of Fauquier County. If you have somebody that does need help, we do have a searchable database of mental health providers in our community. We also have links to other information about common concerns. The Child Mind Institute are experts in minds of children, of course, and they're a great resource for anything that you have questions about, as well as understood as a great way, great communication resource. Thank you so much. It's been a pleasure talking with you today. Please do not hesitate to reach out if I can help in any way. Thank you.